Namaskar and a very warm welcome to this edition of the Phone In program. I'm Nidhi Kumar and you're watching India Science. Well, amidst the ongoing COVID-19 pandemic, the Council of Scientific and Industrial Research on Friday informed us that even if the third wave comes in this country, its intensity may be low. Meanwhile, the country's cumulative COVID 19 vaccination coverage crosses 86 crores in the last 24 hours. Well, in this phone in program where you can ask your questions, we take your queries live. So today we are joined by Dr. Nitish Naik, Professor of Cardiology at the very prestigious All India Institute of Medical Sciences. Many thanks for joining us today. Namaste and welcome to the program, sir. Right, sir. My first question to you is if you can please tell us about the cardiology scenario in India after COVID 19. This question I'll take, sir, before we get our callers. Thank you.
So it is important to understand that India is going through a phase in which we are seeing a lot of premature cardiovascular disease happening in our population. In fact, 1 in 4 deaths that happen in this country are either due to a heart disease or because of stroke. And that adds obviously to a sizable number of deaths in our country. Now, why are we seeing this epidemic of cardiovascular disease in our country is something that is to be understood, because while we do read that genetic predisposition is an important element to having premature cardiovascular diseases, it is important to understand that the bulk of cardiovascular disease that happens in any individual or in any country is because of lifestyle-related issues which are easily preventable and modifiable. So among the most important lifestyle-related issues that contribute to cardiovascular disease are factors like sedentary lifestyle, unhealthy eating habits, being overweight, as well as risk factors, for example, diabetes and hypertension. In fact, we are noted to have maybe the highest numbers of diabetics and hypertensives in our country compared to all other countries. But while this is a cause for concern as to the premature occurrence of these diseases, it is important to understand that each of these lifestyle-related issues can very easily be addressed by people by adhering to simple measures, for example, having a healthy diet, following a holistic lifestyle, which includes yoga, exercise, and good sleeping habits, as well as being aware and being careful about the fact that we can have blood pressure, diabetes, and all these other diseases. They can easily be checked and modified. And should one be diagnosed with any of these conditions, the treatments are very easy and affordable. The modification of lifestyle-related factors, for example, reduction of weight may itself be able to cause these diseases to disappear. And should they persist even then use of simple drugs, which are very cheap, affordable, and easily available across the country, can lead to good control and prevention of all these diseases in the country.
Absolutely. So, a variety of reasons that could perhaps trigger myocardial infections and diseases related to heart. We're joined by our first caller now. Ruchi Kumari joins us from New Delhi on Hot Switch. Namaste, Ruchi. Please ask your question.
Namaste, ma'am. Hello, sir. Sir, I would like to know, there have been, few heart attacks, in fact, a variety of myocardial injuries which is associated with COVID-19. Can you elaborate on that, what?
Yes, you have raised a very important question as to is COVID-19 leading to more heart attacks among individuals? And what we have observed is that COVID-19 contributes to heart attacks in two ways. One is because any infection, when it happens, it need not be COVID-19, even ordinary, viral flu that used to happen, which used to call influenza in the previous years, any infection can predispose to causing heart-related problems, because when there's infection, there's essentially inflammation in the body. And this inflammation in the body can trigger a cardiovascular event. So yes, infections can raise the possibility of having a heart attack, and we need to be aware of that, and we need to address each of these factors when we treat patients who have got COVID-19 and maybe risk factors for developing a heart attack. The other way that COVID-19 has been contributing to heart attacks is in patients who have developed very severe COVID. When you have a very severe COVID infection, you must have heard of terms like cytokine storm. And during these episodes of cytokine storm, these inflammatory materials which accumulate in the body can cause heart attacks by two ways. One is it can cause what we call the lining of the blood vessels to become disrupted. And when the lining gets disrupted, clots can form. And the second way is in patients who have got some existing blockages. In those, there can be an increased demand on the heart to pump better because the body is inflamed, and therefore it may cause this supply mismatch issues which can cause heart attacks. But even when it should be understood that this is not seen in the majority of people, it is seen only a small minority of the patients. And when these patients are being treated, doctors are aware and cognizant of the fact that COVID-19 can lead to these problems, and therefore you must have heard that patients who are having severe COVID-19 infections or COVID-19 patients who are going through a severe inflammatory phase or COVID-19 patients who have got multiple risk factors, we are indeed prescribing some additional medicines to take care of this risk.
Absolutely, doctor. And I hope that answers your question, Ruchi. We go on to our next caller now, Rohit from Mumbai joining us. Thank you, Rohit. Please ask your question.
Hello, ma'am. Hello, sir. Sir, my question is, please explain the problem of blood thinning.
Yes.
This is in relation to COVID-19, doctor.
Yes.
People are having a lot of blood thinners also.
Yeah. So, Rohit, what happens is that when you have a patient who is going to have, who's predisposed to a heart attack, what essentially happens is that the blood vessels have got a smooth lining inside these vessels. And when these linings become disrupted, either due to cholesterol deposition or as we heard about these cytokine storms, what happens is this disruption in the lining of the blood vessels causes some predisposition to clot formation. And this predisposition to clot formation can be prevented by giving medicines which are blood thinners. Now, blood thinners are the two forms of blood thinners that we commonly use in our clinical practice. One blood thinner is the one that acts on one of the elements of the clotting system called the platelet. The platelet is an integral part of the system that causes clotting, and therefore platelet activation causes clots to form. So one class of medications that are given to people who have got heart diseases or who are predisposed to heart diseases is to give antiplatelet medicines. And you must have heard the drug called aspirin, a very common and very simple drug that is used. There are some additional antiplatelet drugs that are available in the market and which are being used for patients like clopidogrel, prasugrel, ticagrelor. And all these class of medicines are given to patients who have got, one of these medicines may be given to people who are predisposed to clotting. The second class of drugs that are given are called anticoagulants. And what are anticoagulants? In addition to platelets, there are certain factors that are circulating in the blood that help to form a clot. And these are called various types of clotting factors. And therefore, there's another class of drugs that acts against these clotting factors. You have drugs like warfarin and echinocumab, and you have other drugs, some newer anticoagulants, which are also used for these patients. So those drugs can be drugs like apixaban, they can be drugs like dabigatran, rivaroxaban, and so on and so forth. Two classes of drugs are, one of them may be used, or sometimes both of them may be used in patients who are predisposed to clotting. But remember that whenever we use such drugs, we have to carefully weigh the benefit versus the risk. Because whenever you give a blood thinner, remember, you may increase the risk of bleeding. And therefore, when you want to give these drugs, the clinician should be very aware of the clinical profile of the person, and he should weigh in all the possible risk factors that can heighten the risk of bleeding. Sometimes the people who are at high risk of bleeding are also the patients at high risk of clotting, and that time you may want to use one rather than two drugs. So this is how clinicians come to a decision on the choice and the agent that you need to give for patients who are at risk for clotting.
Absolutely, sir. I think very well explained. We're joined by another caller. Neha joined us now from Lucknow. Please ask your question, Neha.
Hello, ma'am. Hello, sir. So my question is although COVID-19 is a primary respiratory disease, as we all know, but 20% of patients develop severe cardiac symptoms also, hypotension and etc. Have you had any experience with intra-aortic balloon pump and ECMO or percutaneous ventricular exit devices in this setting?
Yes, a very interesting observation, Neha. So, patients who develop severe COVID-19 are predisposed to cardiac problems because, COVID-19, as you may have heard, has got a spike protein that attaches to a receptor on the ACE2 protein, and therefore it affects the heart as well as the blood vessels, as well as a multitude of other organs, including the lung, pancreas, kidney, and so on. Now, when patients develop severe COVID-19, they can develop heart failure as well, or they may develop severe respiratory failure. And when these two things happen, you may have to give some device to support their heart and or their lungs. And one of the devices, as you rightly said, can be an intra-aortic balloon pump, which is used to support the heart, or you may want to use devices like ECMO, which are temporary support devices, which can be used both for the heart and for the lung. When you use a veno-arterial ECMO, you are using essentially supporting the heart and the lung. When you're using a veno-venous ECMO, you're essentially supporting only the lung. So these sort of devices are used in some patients with COVID-19. We carefully select the patients who are likely to benefit from these things, and often the degree of support that is required is only for a few days. And during this phase, when the cytokine storm gets over, then the patients can come back to their normal condition. Yes, there may be patients who have got underlying risk factor. For example, they may have a pre-existing weak heart. And in these patients, sometimes you may have to use some other additional form of LVSS device as well. But that is basically a person who has got a pre-existing weak heart and is now going into a heart failure sort of condition.
Absolutely, sir. Shweta is asking us from Bangalore, and her question is coming on the YouTube. I'll just take that. Can COVID vaccines increase the risk of heart complications such as a stroke? She says her father is 90 plus years old, and she does not know whether he should be able to withstand taking the second dose because he's in a frail condition. So, would you please like to explain this?
Yes, Shweta, I do understand your concerns that, when you are giving a senior person like your father who's in his 90s, should I be concerned about the probable side effects of COVID-19 vaccine? And is my father or is my brother or my grandparents at increased risk because of a COVID-19 vaccine? Well, Shweta, let me assure you that COVID-19 vaccines have been shown to work across all age spectrums. Yes, there may be certain groups of people who may be at an increased risk for COVID-19 vaccine-associated complications, but do recognize that many of these complications are rather idiosyncratic reactions which may happen because of any other drug as well. So if a person does not have any prior history of having a hypersensitivity reaction, essentially a severe allergic reaction to a previous known drug or a constituent, then I don't think so we should be overtly concerned. In fact, do recognize that the possibility of having an infection or having a problem due to a COVID-19 vaccine is pretty remote. In fact, it would be the same as being the chance of being run over on a busy road in a tier 1 city. And that has certainly not prevented us from walking on the roads or driving on the roads. So I would really like you to understand that the risk of having a problem with COVID-19 vaccine is not zero, but it is so low that the risks are far lower than the benefits that you have with COVID-19 vaccine, and these benefits are there across the age spectrum into their 90s as well. Yes. COVID-19, the benefits of COVID-19 vaccine at extremely young ages are still being examined. And when COVID-19 vaccine has been given to children as young as 12, we did notice some increased risk of COVID-19 vaccine related, the mRNA vaccine related, not the other vaccine related. The mRNA vaccine has been associated with some increased risk of cardiovascular problems in children. But again, the degree of benefit that is likely is much more better. And in fact, even when the mRNA vaccine reported myocarditis that was seen to be elevated in risk in children between 12 to 18 years of age, the risk was very low. And in fact, there were very few serious adverse events that were they observed. Many of these so-called side effects actually improved over a period of time. So my one-liner would be the risks are there, but they're extremely low, and the benefits far outweigh than any anticipated risk.
So as doctor saying, Shweta, go for that jab for your father. Joining us now is Deepika Mishra from Lucknow. Please ask your question.
Hello? Hello?
Yes, please carry on.
Yes, sir. My question is, I wanted to know about triple mutant variant that has been detected in India.
Yes, Deepika, there are lots of variants of concern, variants of interest, variants under monitoring that are being seen. And we should recognize that while these are important for us to understand what they may hold for us in the future, we should do understand that this is something that the virus is prone to do and will do, because whenever there are virus multiplies, there will be new variations that come in. Some of these variations may be just variations of under which we just monitor, and they may not cause any problems. But yes, there have been certain variants of interest, for example, the alpha, beta, gamma, delta, and the triple variant, where it has been shown that it is shown to be more infectious. It may sometimes be more transmissible, but fortunately, none of the variants have been still shown to cause a more severe disease, and all these variants have still responded well to our vaccine. Remember that the virus does not have too much mutation options at its reserve also. Its ACE protein is all that it can mutate as of now, and our vaccines have fortunately been able to target that receptor very well, and the antibody levels have been sufficient. Sometimes even a single dose works, and in some other vaccines, 2 jabs have worked well. And combined with the mask, any concerns, any public health concerns regarding these variants are limited. So we have come out winning on all notes so far, and I do feel that given the fact that we have vaccines that are showing a good sustained immune response and have reduced the chances of infection across the world and across all types of vaccines, these variants of interest, these variants of concern will continue to evolve. We are certainly not heard about the last mutation that is there. They will keep coming, but I do feel that we should be able to address each of these in something that is a satisfactory manner and something that is able to protect us from severe infections.
Absolutely, sir. Another YouTube question that I'm taking now, with your permission, is that Renuka is asking from Nagpur whether COVID infection may lead to weakening of heart muscles in someone who already has a cardio problem. Would you like to elaborate on this, doctor?
Yes, Renuka, I'm sure you must have read a lot in the internet and on some of these debates as to COVID-19 causing some infection of the heart muscle. Well, yes, that is indeed true that the COVID-19 virus does affect the cardiac muscle, and in people who are young and old, it does not, across all age spectrums, it has been noted to affect the cardiac muscle. But fortunately, do recognize that while it does affect what we call, does it cause myocarditis, it has been seen with many other respiratory viruses as well. And right now, because we have been investigating these patients more rigorously, far more rigorously than was done in the past, we are finding a more, maybe a higher incidence, reported incidence of infection. Do recognize that this was not the same standards that were applied to previous respiratory viruses, and therefore we really can't say that the COVID-19 virus is causing more infection than others. That is something that will still be, we have not had the last word on it. But but even when it does cause myocarditis, that is an inflammation of the heart muscle, by far the majority of these inflammations are mild. Patients recover on their own. They have not required any specific therapy, and therefore, it has not been of major clinical concern to us as of now, which is why we do not recommend that you need to screen patients who have got mild, moderate, or severe COVID-19 infection when anything more than an echo, and that echo even if required. So echo is not required for every person. It may be only required when clinically directed. It is not required for every person. And in patients who have got pre-existing weak hearts, yes, there may be a concern that when you have got an already weakened heart and you develop a severe COVID-19, maybe you need some special, you may go through a more severe course. But yes, that would be true regardless of whether it was a COVID-19 infection or any other infection. So patients who have got a weak heart anyway would be required to take some medicines to make their heart stronger, and we have a lot of medicines that can help do that. And should these patients encounter any problems, we can effectively address this in majority of the instances.
Yes, doctor. Joining us now is Ramesh from Kerala, Tiruvananthapuram. Yes, Ramesh, please carry on, ask your question.
Hello, ma'am. Hello, sir. Sir, my question is heart attack different in women?
A very important question, Ramesh. Something that has baffled us all these years. Women do present differently from when they have cardiac conditions. In fact, you must have heard us say that, and must have read on the internet, that when you get a heart attack, people generally develop chest pains that is there in the center of the chest. A person tries to clench his fist. That's how they describe the chest pain. The pain may radiate to the left arm, it may go on to the left shoulder, it may also go to the jaw. But in women, many of these symptoms may be completely absent. In fact, women may present with what we call an atypical chest pain. That is a chest pain that is not there in the center of the chest or on the left side, it is rather on the right side. It may not be provoked with exertion. It may be sometimes associated with local tenderness. So these are atypical symptoms. So yes, women do behave differently. And why does that happen? We really can't say. But yes, that's why we should be very careful when we are assessing a lady who complains of chest pain. We should not be sort of dismissing her symptoms or taking them lightly. We need a proper diagnostic workup. But do recognize that women are protected from developing cardiac problems as long as from their hormones, estrogen and progesterone, as long as their ovaries are active. And when they enter menopause, that's when the risk of cardiovascular disease actually catches up. And by the time women reach into their 60s and 70s, in fact, the risk of a heart attack in a lady matches that of a male of the same age group. So women are at lower risk for heart attacks. Yes, that's completely correct, and that's there as long as their ovaries are active. But they may still be at risk for cardiac problems, especially if they're not careful about their lifestyle, or if they have some other additional risk factors like uncontrolled diabetes, uncontrolled blood pressure, or very high cholesterol levels. And obviously, poor lifestyle may add to that. But yes, the ovarian hormones do offer them a lot of protection from cardiovascular diseases.
That's right, sir. And now joining us is Sanjay from Mumbai. I'm taking his question on YouTube, and he's asking what are the long-term antiviral drugs and their impact on heart health. If you could specify about these drugs and their impact, because people are in a state of confusion, affected or not with COVID-19. What are the actual antiviral drugs to take in a heart problem?
Well, we really don't use antiviral drugs to. They were used to in patients who developed COVID-19 in the past, and they believe that they will help them. The last word's not said on that, but still, you must have heard that remdesivir did not perform very well in mild to moderate COVID infections, and therefore remdesivir is actually not being prescribed for these patients. In severe COVID infections, it had been used, and there were some reports of some benefit. But do understand that antiviral drugs are not really indicated for the vast majority of patients who develop COVID-19. There may be some select situations where you may be wanting to use some of these drugs. They are much better, cheaper alternatives like steroids, which work far better in COVID-19. So with respect to COVID-19, antiviral drugs do not have any major role to play. There are more trials going on other newer drugs which may work out, and they're looking at that. But as of today, antiviral drugs do not play a major role in improving cardiovascular health in COVID-19.
Absolutely, sir. Now joining us is another caller. Did I interrupt you, sir? Please carry on.
No, what I was saying that COVID-19, the antiviral drugs, even in patients without cardiovascular conditions, antiviral drugs do not really have a major role to play.
Yes, sir. Joining us is yet another caller from Gwalior. Suman, welcome, and please ask your question.
Yes. So my question is, reports have suggested that primary respiratory failure is the predominant finding with associated fever, cough, and other flu-like symptoms. But COVID-19 has, broad spectrum of presentation. Now, do you think this is true, or do you have a different perspective?
You see, COVID-19 is an infection that is involving practically the whole body. And the COVID-19 infection is not only an acute illness, there is something that you must have heard about long-term COVID. There are patients who are having a mild respiratory illness. There are people having a moderate to severe respiratory illness. Some people are presenting with the gastrointestinal symptoms. Some people are presenting with a cardiac condition. So people have so the impact of COVID-19 on clinical presentation has been significant, and COVID-19 need not always present as a respiratory illness, as you rightly said. Some patients have come to notice because either they developed a stroke. Some people have come to notice because they presented with an acute myocardial infarction, that is a heart attack. Some people have presented with a predominant gastrointestinal symptoms. And in fact, many patients, and in children, you must have heard that they've been presented with other things like a Kawasaki disease. So the presenting feature of COVID-19 can be significantly varied. And in fact, there is a sequelae to COVID-19 as well, a long-term infection, which is completely unrelated to the initial severity of the illness. So yes, COVID-19 is something that we are learning more and more about every passing day. And we hope that we are able to come back with something that can help us, understand this infection and address many of these things, like how do we effectively prevent a relapse, or not really a relapse, the occurrence of a long-term COVID. So the science is progressing on that, and we certainly look forward to clinical studies in this area.
This is a science program, I'm taking one more scientific question with your permission, doctor. Pune, Kunal is asking us this question, and he's wanting to know about technologies like remote cardiac monitoring that enables heart patients with implants. What is new in your field, sir?
Well, Kunal, there are lots of interesting things that are happening in this field. Remote monitoring has become of special interest to us in the current situation of COVID-19, because many of our patients did visit us in clinics, and we do recognize that many of these patients can be monitored from home. So we have a lot of telehealth applications available. Patients who have got implanted devices like pacemakers, cardiac defibrillators, or resynchronization therapy devices. Now these patients can be monitored via internet through simple devices, and we can look at the status of the devices, how well it's performing, are there any concerns that we should be addressing without having the patient physically visit us in the clinic. Similarly, There are many devices that are available, which are disposable patches, which can look at the person's ECG, and the patient need not come to us. So there are patch electrodes which are available, which can be stuck to a patient's chest, and with that, we can monitor their heart rhythm. There are other, you must have heard so many gadgets that have come up, which can be wearable devices, which tell us about your heart rate, about your saturation, about your other conditions. In fact, some of them even venture to tell you the heart rhythm. And all these things are based on many of these are based on artificial intelligence. So there's a exciting new future that awaits us as we try to move away from the regular devices to these exciting new wearable technologies which help us to understand our heart health. And this can be a subject of a separate program where how can we improve our diagnostics information, our therapeutic information through these new emerging devices.
Yes, sir, and I'm sure we'll take this up in the next time when we talk to you. And in the end, I'd like to thank you, Dr. Nitish Naik, for joining us today. And with this is a wrap of this edition of the Phone In. I hope that everyone has acquired immunity from the vaccines, and we will indeed produce long-lasting protection against SARS-CoV-2. And on that note, many thanks for watching. Namaskar.